Hey, just imagine for a second you step into a shoe and suddenly feel like a pebble is lodged under your foot, except the pebble isn't going anywhere and every step reminds you it's there. Welcome to the world of Morton's neuroma. Despite the potentially scary name, this neuroma is not cancer. It's simply an entrapment of the interdigital nerve that can cause disproportionate pain in the forefoot. Though small, this condition commands big attention in podiatry, orthopedics, and primary care. Today, we will explore how to spot it, understand its impact, and manage it, so you never mistake a neuroma for a pebble again. Alright, so on this slide, we have an illustration of the foot, and on the left side here, we can see the interdigital nerve, which sits comfortably beneath the transverse metatarsal ligament right there. Okay, on the right side, we see a Morton's neuroma, which shows why this nerve is so prone to compression and irritation, especially in the third web space. So I want you to be conversant with web spaces. You can see the first web space right here, the second web space, the third web space, which is the most common location for Morton's neuroma, and a fourth web space. I also need to say that the second web space is the second most common location for Morton's neuroma. So as you can see on the right side, as the nerve passes through the metatarsal heads under the ligament, the nerve can get trapped, leading to thickening and fibrosis. These changes are what causes the classic forefoot pain we see in Morton's neuroma. So the exact cause of Morton's neuroma isn't fully understood, but it's thought to result from factors such as nerve entrapment, trauma, inflammation, or reduced blood flow. These factors can compress and irritate the interdigital nerve under the plantar side of the transverse metatarsal ligament, as previously explained. Now, despite the name, it is not a true neuroma. Rather, the tissue around the nerve thickens, producing that familiar stepping on a marble sensation. This leads to what is called interdigital compression syndrome, right there. The condition most commonly affects the space between the third and the fourth metatarsal heads. Okay, though the second web space can also be involved, but involvement of other spaces is very uncommon. Women are affected more often than men, so that push off position in a high heel shoe, yep, that makes things worse. Okay, so let's talk about how Morton's neuroma actually shows up in patients. First, let's discuss the location of the pain. Most commonly, it's right between the third and the fourth toes. Occasionally, it can also affect the second web space. Now, the quality of the pain. Patients often describe it as burning or sharp right at the ball of the foot. And here's the classic description. Have you ever heard someone say it feels like there is a pebble or marble under their foot? That's our classic clue. Aggravating factors. Anything that squeezes the foot, tight, narrow shoes, or yes, those glamorous high heels that you admire, they can make the symptoms worse. And don't forget neurological symptoms. Some patients in severe conditions get numbness, tingling in the shoes. So when you put all the symptoms together, you're likely looking at an interdigital nerve under stress. Investigating Morton's neuroma is mostly about careful observation and hands-on assessment. Start with a thorough history and physical exam. Patients usually give you the biggest hints. Check the foot joints, look, feel, and move them to spot tenderness, swelling, or limited motion. Next, focus on the neurological exam. Test for numbness, tingling, or altered sensation in the toes. Light touch and pin prick along the interdigital nerve can also reveal subtle changes. Don't forget the T-nail-like sign that is tapping over the suspected neuroma may reproduce the pain. Your eyes, fingers, and simple neuro tests are your tools to catch the nerve in the act. A note on imaging, typically not required, but may be used when the diagnosis is unclear or to rule out other pathologies. X-rays can help exclude fractures, ultrasound can identify the neuroma, and MRI is reserved for atypical or persistent cases. Treatment, and here we're going to start with the simplest recommendation, changing the shoes. For patients with Morton's neuroma, high heels and tight, narrow footwear are the worst offenders. They squeeze the metatarsal heads together and irritate the nerve even more. So we advise switching to wider, roomier shoes that give the forefoot space. Once we have tackled footwear changes, our next step is adding a bit of support. Orthoses and shoe inserts can help spread the metatarsal heads, reducing pressure on the interdigital nerve, often a simple tweak with a big payoff. If symptoms persist, we can explore injections. Corticosteroids or nonsteroidal anti-inflammatory drugs may calm the inflammation and provide meaningful short-term relief. For patients who need more, there are additional options. Extracorporeal shockwave therapy and even radioablative treatments can be considered to decrease nerve irritation. Surgery is the most reliable form of treatment when other options fail. The procedure either removes the swollen portion of the nerve or releases the surrounding tissues to decompress it. And don't worry, most patients are back in their shoes again in about a month, preferably not the high heel kind. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.